Welcome to our ArtsRx session.
Good afternoon. Hello. How are you all? Excellent. That's great energy for 4 p.m. on a Sunday. Thank you for that. We're going to try to keep that energy up for the next 90 minutes as we talk about the intersections of arts and health, which I realize may be a brand new idea. For any of you, is that like, what? Arts and health? Is this a brand new concept? Wave your arms if so. Oh, this is great. It's not. Okay, we're preaching to the choir this afternoon, folks. This is great. So we're going to begin by introducing ourselves, and I'm going to start by asking these beautiful people to introduce themselves by talking a little bit about how you locate yourself at the intersection of the arts and health, and what do you do there in that space? John, would you start?
Sure, yeah. Good afternoon, folks. My name is John Schreiber. I'm the CEO of the New Jersey Performing Arts Center, and that is right across the river in Newark, New Jersey. And we sort of pride ourselves of being the most diverse performing arts center in the country in terms of our audiences, our programming, and our staff, and that's very intentional on our part. We have a very robust social impact program that has 3 different business units in it. One is arts education, the other is community engagement, and the one we'll talk about today is arts and health. And up and down the state of New Jersey, we do about 1,200 performances a year. About 40% of those are free to community. And the intersection between the work that we do on various platforms and arts and health is really interesting and is growing every day. So this is an exciting field for us, and I'm excited to learn from my colleagues and share with you what we've learned.
Beautiful. Thank you, John, for bringing that Performing Arts Center perspective. Dasha, would you follow?
Yeah, sure. Can everyone hear me? Okay. Great. I'm Dasha Koltunyuk from Princeton University Concerts, where I get to work on programming very closely with our executive director, Marna Seltzer. I'm really honored to be here with colleagues who approach arts and health from so many different angles, and I'm excited to learn from you and to offer a perspective that's perhaps not very grounded in a formal clinical arts and health framework. My path into this began a long time ago. It was a very personal one. My mother was pregnant with me and on strict bed rest at the maternity hospital in Odessa, Ukraine, but she would sneak out most nights to go to the Philharmonic or Opera House to stay sane. So I like to think of myself as a product of, ArtsRx in action. And a couple of decades later, with music having sustained me through a cancer diagnosis and other major life hurdles, I tried to take some of that experience into my work at Princeton University Concerts by starting one of the first live music meditation series in the country, inviting world-class artists to perform as people meditated. And then in the wake of the pandemic, I started a new initiative called Music and Healing, which invited artists to speak to their own relationships with music through difficult moments in their lives, through events combining performance, conversation, and film, really as a way to help us all not take the arts so much for granted. And I just want to say off the bat that I think what's so important is that none of these initiatives were explicitly developed as wellness programs or as health interventions, but rather they just grew out of this desire to engage with music and musicians as mindfully and humanly and connectedly as possible. And what we've learned is that when you create these moments for connection, vulnerability, and listening, that the power of the arts manifests organically and quite powerfully.
Thank you, Dasha. Nataki?
Hi, everybody. I'm Nataki Garrett. I'm the CEO of Ladder Leadership Services, and I'm also the former artistic director of the Oregon Shakespeare Festival and also the former artistic director of the Denver Center for the Performing Arts Theater Company. And I came to this intersection between arts and health coming off of my leadership journey at the Oregon Shakespeare Festival, still looking for this way to center the artist as a thought leader and change maker who transform lives. And my friends Lear de Bassanet and Clyde Valentine invited me into a project that they were working on at this intersection between arts and health. I also worked with Dr. Jill Sonke on that as well. And my interest in it was, you know, I come from an industry that focuses primarily on creating art for a kind of status quo audience. And there's a lot of conversation about not doing that, but mostly what they're doing is that. And I've always been interested in, you know, the audience beyond that audience, you know, or the audience that is adjacent to that audience, and how do you connect to those people? I've also been interested in this conversation around like who's actually focusing on and supporting the artists themselves and their health, right? There's a lot of extraction from artists. A lot of people receive good from what artists do, but there isn't a lot of focus in this country on what the artist actually needs. So here was this ready-made project that I got to be a part of for 18 months, in which the idea was the artist was necessary, you know, to society, and we didn't have to answer that question. What we were answering was, if somebody's teaching ceramics in a community center, then you actually have to support the artist that's doing that, and their impact on society has to be named, it has to be clarified. And so we worked with 18 cities across the country in this grand engagement. One day, the 27th of July, 2024, all 18 sites engaged in some sort of artistic activity for their communities. We caught it all on, you know, we have all these artifacts left over, and then afterwards there was an application that allowed people to engage in the conversation about how that societal framework and that connection to art actually affected their lives. And so it culminated last year, 2025, in June, and that's my point of entry into this conversation.
Beautiful, thank you, Nataki. And Michellene.
Thank you so much. So I am absolutely delighted to be at your conference among all of you, because to me, you are healthcare workers, really. Let me explain it. My name is Michellene Davis. I am the president and CEO of National Medical Fellowships. National Medical Fellowships, or NMF, as we like to call it, is literally the entity that has been advancing things like health equity, the elimination of healthcare disparities, and quite frankly, pursuing an answer to the physician shortage since 1946. Now, clearly, if we've been doing that since 1946 and we are still continuing in this effort, that is because we have not, as of yet, reached the point where there are enough physicians for every patient. More, the reason why I look to you as healthcare workers as well is because the science, the studies, the evidence is sound. That there is so much about art that betters wellness and well-being. More, that healing and recovering is bolstered by participation in, observance by, even proximity to the arts. And then, if we stop for a moment and look at it through the lens of my students, since 1946, we have given out $50 million to more than 45,000 scholars. But when I look at them, I see each and every one on their own personal trajectory and journey as an individual who needs community and support to make it through medical school. But here is the rub. Art literally has the evidence of being able to ensure not just that they complete that journey of medical education, but then that they remain in the profession. You see, you, my brothers and sisters, my family members that I just didn't know before today, you literally help to stave off burnout. You ensure that medical education is that much more profound because you give us an opportunity to ensure that our scholars, those who are learning how to treat patients, to treat you, your loved ones, are better able to have deepened empathy. They collaborate with greater aptitude, They evidence more intellectual curiosity and more soundness of personal thought as a result of how you serve us every day. So congratulations. I'm just happy to be among more healthcare workers.
Yes, thank you so much. I'm Dr. Jill Sonke, and I have the pleasure of serving as a U.S. Cultural Policy Fellow through Stanford University at the National Academy of Medicine in Washington, D.C., and at the Federal Reserve Bank of New York here in the city. I have been working at the intersections of the arts and health for more than 35 years now. I, as a young person, was headed toward a career in medicine, and then I stumbled on dance in high school and went that way. And then when I went to teach dance at the University of Florida in the early 1990s, there was a program just beginning called Arts in Medicine at UF Health Shands Arts in Medicine. And I was just astounded that I could be an artist in healthcare. And so I became one of the first 2 artists in residence in that program and worked as a dancer in residence for many years. And at that time, in the early 90s, there were about 5 programs, 5 hospitals in the United States that had the same idea and were beginning to explore what it would mean for artists to come into the hospital. That inclination and all of the work that I've done in my career is based on the understanding that human art behavior is a thing. Human beings, as you well know, have always engaged in the arts. And when we look across human history, there is no point in time or almost no culture where the arts have not had a place in healing. In Western culture, in biomedicine, the arts have come along, but they've largely been absent. So over the past 40 years, we've seen this renaissance in Western biomedicine of the arts becoming recognized. As when I started in the 1990s, actually people thought it was really weird. I kind of made people uncomfortable. And then we progressed as we kept showing up as artists, and people were like, oh, that's really nice what you do. And then, as Michellene said, this evidence base has grown in the field, and today, because we do have prevalence of programs, we have a field with graduate education and PhDs and careers and professionals and research, now there is a general understanding pretty globally that the arts are actually important, if not essential, to healthcare, and that artists are essential members of interprofessional care teams in healthcare. So my career evolved. I've done research for many, many years. I run a National Endowment for the Arts research lab called the Arts Lab, and we do epidemiological studies. So we do population-level research, and we know things like, for example, older people over the age of 50 who participate in the arts just once a month or more in the US are 20% less likely to be depressed. In the UK, they're 48% less likely to be depressed. We know that the arts have significant protective effects against a lot of diseases and conditions. They help people with Parkinson's disease to progress, for that disease to progress less rapidly and to manage symptoms. There is an array of really compelling research now that I've had the pleasure of generating. And I worked with Nataki for the 3 years of One Nation, One Project, which was a national arts and public health initiative, and today I work on policy. So I hope through these introductions that you're beginning to see a landscape. The arts live in hospitals in the United States and globally. There is a hugely growing understanding that the arts are really instrumental to disease prevention and to disease management, right? So we see this field of arts and public health that's growing so rapidly. We see performing arts centers entering this space, recognizing that partnerships with healthcare can help, as Michellene said, help artists and the arts to understand what we do, that the arts are a health resource, and that arts participation is a health behavior. We know it in our bodies, right? The epigenetics of where the arts live in the lives of communities and societies is deep, and we know it now through practice and research. So we're going to dive into some conversation, and we're going to interrupt each other and just talk, let our conversation evolve. I have a few points that I'd love to help us cover, but we also are going to bring the conversation to you. There's 2 microphones, and so at least one point in our conversation, I'll invite you to bring your questions or your comments to us. But I'd like to start with a pretty basic why that we've touched on to some extent already. And since we're here at APAP, John, I thought we might start with you. Why would a performing arts center want to engage in health partnerships?
So we say that performing arts centers are community health centers, right? How many of you actually work at places like NJPAC? Not that many, so some, yeah. What we've discovered is, and you know this, you go to a concert, you walk in, you might be anxious or depressed or angry or any number of things, and odds are good, on the way out, you feel better. That's a health outcome. That's a positive health outcome. And I would say pre-pandemic, Michellene is a pal of mine for many seasons. And pre-pandemic, we started a conversation at NJPAC with RWJ Barnabas Health. And Michellene was a senior executive there for many years. And I'm not a doctor. I don't play one on TV. My knowledge of healthcare and the benefits of the arts and health was unknown to me when I started the conversation with Barry Ostrowski, who was at that time the CEO of Barnabas. But I knew that there was something there because Barnabas had already begun to engage in community. Newark is a very poor community. A lot of our community members don't have regular access to GPs and to medical care, and often the emergency room becomes the GP. So how can we make healthcare, how can an arts center make healthcare less intimidating to community members? And we started with Barnabas to offer tabling and blood pressure testing and all sort of minimal things at our free events. And we do about 400 free events throughout Greater Newark every year. And we realized that we were onto something. So we started conversations with Barnabas and experts there about this intersection between arts and health. And about a couple of years into this exploration, we hired someone whose name is Ali Meyer-Lakuta. She is a mentee of Dr. Sonke. And we brought Ali on and we said, gosh, let's do a feasibility study about how we can integrate initiative of arts and well-being into what we do every day. And Ali came up with a proposal to us that included 5 pillars for an arts and health program. And those pillars included arts and healthcare, ArtsRx, which is arts on prescription, health promotion, which are performative programs where we engage community members, access, education, and training, and that's online programs. And then, as important as anything, was research. And so we created research relationships with the Rutgers School of Public Health and the Mason Gross School of the Arts, which is part of Rutgers. As we developed these ideas, as Ali sort of workshopped these ideas throughout our community, we realized that this was, in addition to arts education, which we've been doing for 30 years at NJPAC, and community engagement, those free events that we did throughout community, there was an opportunity to integrate arts and health programming into almost everything we did, from our main stage programs to our free outdoor community events. And then we went to a couple of key funders. One was Barnabas, and the other was Horizon Blue Cross Blue Shield. As part of a larger fundraising campaign, we asked them to endow this work with us, at least to get it started. And so between the two of them, we were able to fundraise an endowment of about $4.5 million. So those of you who work with endowments, you know you never take more than 5% as a draw from an endowment. So, you know, out of $4.5 million, we had $400,000 a year that we could use to begin this work. And what we discovered as we started it with Horizon and with Barnabas as our key partners was that there was enormous traction and resonance with the work. And as a fundraiser, and if you're in the nonprofit arts, I'm sure you agree with me that you got to fundraise morning, noon, and night. As a fundraiser, what I discovered was that this was a new area that interested folks who might not want to fund the arts as the arts. Because really what we're trying to do with this work is change outcomes for community members by virtue of participation in the programs. I won't get into the specifics of them now. We will, I'm sure, as the program goes on. But what I discovered as a non-expert is that this work operates across everything we do at the Arts Center now, in our building, outside of our building. One of the things I'm most proud of, and Jill was a co-producer of this, was we gathered 500 folks from around the country for a Creating Healthy Communities conference in Newark this past October, yeah. And we shared best practices. We brought in 60 experts from around the nation. And I had never been to a conference that was as full of joy as this conference, because this is a coalition of the willing. And in this work, there are nooks and crannies that many of us in the field are doing this work, and we're not even aware that we're doing it. And so raising up this work in a way that made it accessible to everybody was just fascinating. As I think about everything we do in social impact at the Arts Center, this is the great connector. This work is the great connector of everything. And the barrier, it's an unintimidating entryway for individuals, whether they can buy a ticket or whether they can't. And that's one of the things I love the most about it.
I love it, that idea of the great connector. And, you know, wellness is the heart of everything, isn't it? Right? It's all about being well in this life. Michellene, I love that you rattled off these gorgeous benefits and the whys to arts in healthcare. I wonder if you can talk a little more about any of that if you'd like, but I'm also curious about how you see healthcare as a sector coming into this space of arts and health. How do you feel as a sector, like John just described as a presenter, what's the parallel to that in healthcare, would you say?
Yeah, I really do believe that healthcare is beginning to catch up with the concept of it at all. I suppose, John, you're right, I should have mentioned, right, and I used to be on John's Women's Association board, right? We should talk about how we work together to do so much of that good work that is living now. But I will tell you this, what is really interesting about healthcare is the following. Now, I'm only going to say this to you because we're all friends and family, right? Okay. So while you are always on, watching TV and you see the newest pharmaceutical elixir that has a new commercial, we know that there have been advancements in medicine, right? Everything in healthcare has traditionally gone through a period of innovation except healthcare administration, right? So the way in which healthcare gets delivered has been pretty much the same since we started doing it. Remember the leeches and no, we're all too young, we're all too young. But I do believe that now, that even at the administrative level, and I say this as John is correct, a prior executive vice president and chief corporate affairs officer of what is the largest healthcare system in New Jersey, prior to coming to NMF, that now there is beginning to really be this fundamental understanding of that to which we spoke earlier. The evidence that's there, and quite frankly, what I really think happened to open the blinds on it was something that we very infrequently talk about as having any positive effect or impact, and that was COVID. During the first wave of COVID-19, I will tell you this, as someone who was within a healthcare administration, I lost not 1 or 2, not 3 or 5, but 30 colleagues during the first wave. When we talk about burnout, we were talking about it in real time. Individuals who were leaving hospitals to go home and strip down in the garage, right? To run into the shower before seeing anyone in their home, deciding that night that they just couldn't do it anymore and couldn't go back the following day, decide nevertheless to show up the next morning. What so many hospitals and healthcare systems did around the country was literally try to figure out what can we do within our confines to create hope for them. And when we began to look at that, we thought about everything from Zen rooms to walkways, but also how do we begin to open up our doors, which were intentionally closed to keep folks alive, open in other collaborative, innovative ways to bring art into what should be a healing space, but during that time was a deeply hurting one, right? So I do believe that no one in administration walked away from that and just chalked it up to an episodic, one-only, arbitrary and capricious discovery. Rather, we finally began to pay attention to the studies and the evidence, right? And to the experts that are in this room. To truly understand that health and wellness and well-being, while are yet different things, are completely interrelated and completely dependent one on another in order to truly have healthy communities.
Yeah, that's such an important point, Michellene, that it really harkens, for me, my mind harkens back to 2008, the economic downturn. And at that time, it was the field of arts and health in that decade was growing rapidly. The Joint Commission, which is the national accreditation body for healthcare, did 2 surveys and found they had a huge response. Over half of accredited hospital systems responded, and just on the edge of half in both of the surveys reported having arts programs, investing in the arts. And so in 2008, we had a pretty robust field, and it was the first big national challenge where people took a breath and were like, will the arts get cut because they're extras in healthcare? And yes, I saw a couple programs get cut, but what we saw generally was more investment in the arts during that time because those systems recognize that when things are hard, and they are always hard in healthcare, when things are hard, we need the arts. Caregivers need the arts, patients need the arts, administrators and leaders need the arts. So thank you for that perspective. I wonder, Dasha, if you could talk to us from an artist's perspective. Why turn to health? Why dedicate yourself and your time and energy in this sphere of health?
I mean, I think in the context of thinking about arts workers as health workers, there's also a sense of burnout. I think, artists lead incredibly difficult lives, full of a lot of financial instability, grueling physical demands, and they're asked to be these gods, who come on stage and turn on and wow you and leave and they're gone, poof. And what's been fascinating in some of the work that we've been doing is really taking a moment to approach the artist as human. What a concept. To think about what it is that they need, and that when they come on stage, they're really coming to us with their full humanity. And when they do that, then we return with our humanity, and in that circle, something really magical happens. But it demands something very vulnerable, and in the first season of Music and Healing, one of the artists we invited was a cellist named Joshua Roman, who was really struggling with long COVID, and even thinking about whether he could continue a career, whether he could continue playing the cello. And we had a conversation about whether or not he would like to come to our series and talk about that, to say that openly and to really talk about his relationship with his instrument and how difficult that was. And at the time, that was incredibly risky because one of the things he was worried about was that as soon as he does that, a presenter might not want to book him again. And that is so messed up, but realistic. What came out of that is something beautiful, and in fact now he's touring with what he's calling an immunity project and really leaning into this aspect. But another way that we're thinking about that is in our live music meditation programs. One of the really profound things has been not just how moved and restored our audience is coming out of these programs, but the performers as well. They tell us that getting the chance to meditate for just a few minutes before they start playing is completely different than pacing backstage and getting really nervous and coming on stage and having to perform. And they also feel this sense of support from the meditators who are holding a space of silence and focus and mindfulness for them. And so everyone's in it together. And one of the beautiful things that we've encountered is at the end of these programs, we invite everyone to share what the experience was like for them. And often the musician goes first. And the number of times that they've said that they didn't realize how much they needed this, that this was really an opportunity for them to breathe, which is a very simple thing, but just to breathe, how restorative that was really profound. And so really approaching arts and wellness programming for the artist as well has been crucial.
Thank you, Dasha. And Nataki, I'm going to ask you to help us zoom way out now to the national level. So we together worked on One Nation, One Project, which was a really audacious national level arts and health application across 18 very, very different cities. Having that experience, what would you say is the why around the potential for the arts to really change the health of this nation at a national level, in communities, like not in, right, in communities, organically?
Yeah, I think what's really important about the Arts for Everybody initiative was we engaged in partnership with organizations that were doing this work anyway, right? So they didn't really need us to tell them that they needed to do it. They actually came to us because they were already engaging in applying arts practice to health practice and to improving the lives of the people in their communities. And so, you know, in Wisconsin, you had a group of teenagers who had already engaged with an artist to help design a skate park to focus on teen suicide in their community. You know, you had a housing complex in Rhode Island that made the choice to engage with artists to help talk about what it means to live in the projects and how isolating that could be. What I find interesting about it is that a friend of mine made it very plain during the pandemic. She was like, the federal government just basically said that the arts were unnecessary by shutting everything down and really not providing a pathway for arts engagement. And then you had all these artists that were like, well, let's step up and do something anyway, because that's what the artist does. We step up and you know, we reflect the zeitgeist back to the people, and we help people engage and distill for the people what it is that they are going through so that there's a deeper understanding and a deeper connection to humanity. One of the things I loved about the Arts for Everybody concept was to first go to the ARPA funds for resource, that you can co-opt these funds and sort of refunnel them through your arts organization or your health organization or your arts and health community organization, and use that funding to support this initiative around arts and health, that you can hire artists using that resource. And you could make a case to your mayor of your tiny community that that's where the money needs to be funneled. We could convince city managers that artists need to sit at the table in the conversation around how those funds are distributed. And so I think the sort of creative center of the artist that says, I have this need, this propulsion towards expressing and reflecting back to a community what they're going through, but I need the resource to do it. Let me think of the most creative way to get access to the resource that otherwise would be denied to me because I'm not, you know, creating roads. I'm creating inroads and connections. And so we had a lot of people in their communities who were using resources in that way. And I, during the pandemic, founded a coalition of nonprofit leaders to try to get access to the SVOG funding, which was the largest release of federal funding to support the arts in, decades. And one of the things that we had to push was working with our lobbyist. We were like, well, we want to support the people that actually do the art in our organization. And they were like, there's no way you're going to convince the federal government to give you this resource to do that. That's what unemployment is for. And so basically they were saying that the work of the artist was somehow, again, to the side of what was necessary in order for us to be healed as a community. So we just made decisions about how we were going to, once we got access to the resource, how we were going to use it to make sure that the artists got back on the payroll. And the first group of people, that we paid, and that we made sure, and some theaters took that resource and made investments in making sure that artists had full-time salaries with benefits, because losing access to our artists for that long was out of alignment with what a lot of arts organizations were originally created for. And with Arts for Everybody, what I, again, find to be interesting is that we thought we were doing something innovative. And you roll up on these communities, and they're doing this anyway. They're locating resource, and they're using that resource to give to the artists so the artists can have the impact that the artists need to have on community. And so there's already embedded probably in this room, there's already embedded in your thinking a way to make that work happen. And there's money for it. There's access to money for it. You just have to think creatively, which is what a lot of these organizations that we worked with, these community-based health centers, federally funded health centers, community arts organizations, a lot of them actually came back to us with their way of doing it. And we got the benefit of listening to them tell us how they did it.
That's right. Thank you, Nataki. And I just want to follow on that. By sharing a little bit of what we found in this national initiative. I had the pleasure of leading the research enterprise with an amazing team of 13 researchers. We conducted 12 studies, and we integrated 6 of them into one mixed method study and created a theory of change that articulates why and how community-based arts participation builds social cohesion and well-being. And underpinning that theory of change are some of our statistical findings. One that we're really proud of is that through this effort of inviting communities to provide as many opportunities for arts participation in the community for health as possible, across the 18 communities, arts participation increased by 54.6%. Wow. And we turned one consistent national statistic on its head. If you talk to the NEA, AFTA, anybody who's done a national survey around who participates in the arts, we know the social gradients around arts participation are deeply persistent in this country. And we found that across those 18 communities, these efforts resulted in people with lower levels of income participating more in the arts. So these communities were able to make the arts more accessible to people who typically are accessing the arts less. We also, across the 18 communities, in the general population, not among people who participated, but in the general populations, we increased social cohesion by 12.6%. We also found a dose-response relationship in that the people who participated most in the arts had the highest levels of social cohesion and well-being, and those with higher social cohesion had higher well-being. So we know that by engaging the arts, we can improve health at the population and at the community level. We can move the needle on public health. Couple bookmarks have come up for me. John, you mentioned arts prescribing, and I'm guessing that that would be a topic that we could come back to today. You also touched on this idea of colocation. You said at NJPAC you think of and I apologize if I misquote you, but I think you said that you consider your performing arts center to be a health center. When I was working at UF Health Shands Hospital, we considered the hospital to be a community cultural center. And there are a lot of ways that this sort of co-location, both physically and ideologically, can be very instrumental. And Dasha, when we met last week, you gave a beautiful example of working with Jean-Baptiste and Suleika Juad, and I wonder if you can talk about that, because that was a beautiful example of art and health really achieving mutual goals together. Would you share that experience?
Yeah, I mean, Jean-Baptiste and Suleika Juad work really tirelessly at advocating for arts and health because they're lived examples of that. Suleika Juad has been struggling with leukemia for a very long time, and in her event on our Music and Healing series, she and John talked about just the role that music played through that time for them. And we were thinking about, how can we really make an impact? How can this be more than a conversation? How can we do something in the spirit of John and Suleika? And what we came up with was partnering with an organization called Be the Match, which is a donor registry for people who might need bone marrow or blood transfusions. And the idea was that everyone in the concert hall and on the Princeton University campus was invited to swab their cheeks upon leaving the event to see if they might be a match for someone in need of a transplant. And based on the number of people who participated, we estimate that that event saved about 30 lives in a very tangible way. And this was also something that we could do as a small arts presenter with limited resources, is leaning towards a partner who has the infrastructure to do this and to partner with us and offer a way to make a real impact with our event.
Thank you. That's beautiful. And let's, I just want to sort of bookmark again some really great examples of that. There's places like the Jackson Medical Mall in Jackson, Mississippi, right, where the community came together, the public health, social services, and art sectors came together and took over an abandoned shopping mall. And they brought together health services and art services, recognizing that that co-location could really help facilitate the healthcare goals, in that there are a lot of people in that community who weren't accessing healthcare. I mean, that's one of the problems with healthcare, right, is underutilization. And they knew that by providing dance classes, there were people who would bring their child to a dance class, right? And while they're waiting, since it's right there, they might as well get health services. And we see that co-location happening in performing arts centers as well, which is really beautiful. John, would you talk a little bit about your arts prescribing program?
Sure, yeah. And thank you for indulging me in my cough. And I'm grateful to the two folks who came up and gave me cough drops. This is really arts and health in action, right, in real time. So thank you for that. So ArtsRx is something that we started 3 years ago in Newark. And our first partner was Horizon Blue Cross Blue Shield. And in addition to doctors on the Horizon team prescribing medicine and best practices for healthy living, they also began to prescribe attendance at arts events to their clients. And what we did was we created an initiative starting with them, and that was literally prescribing 6 arts activities over 6 months to clients of Horizon Blue Cross Blue Shield. Intake counselors speak to the clients, and they get a sense of what they're most interested in terms of the arts. And then we developed a cohort throughout Greater Newark, about a dozen arts partners, where we would literally send individuals to those cultural organizations for activities. In Newark, we have an entity called Glassroots. That's a glass-blowing nonprofit. We sent them to Glassroots. We sent them to docent tours at the Newark Museum of Art. We sent them to line dancing at Newark Symphony Hall. We sent them to the Montclair Art Museum. We sent them to performances at NJPAC and other organizations. The clients get prescribed up to 6 arts activities over 6 months. They're each allowed to bring 2 guests, because if it's just for you, odds are good you're not going to go. But if you get to bring 2 friends, it gets easier and more appealing to show up. We made a deal with Lyft, and Lyft made it possible for people to get free transportation to and from these different providers. The participants never pay, but we, as the Performing Arts Center, pay all of the culturals who participate. So nobody is ever out of pocket. And the good news there is, if I've never been to the Newark Museum of Art and I go, all of a sudden I may develop an interest in visual art that I didn't have before. So the idea is to get new fans for different types of arts. So far, in the past couple of years, about 300 people have enrolled or completed the program, and over 1,500 arts activities have been participated in by the folks who join it. And we've paid over $110,000 to local arts organizations. Back in the day, when there was a National Endowment for the Arts, you remember that? Remember those days, right? The NEA gave us a grant that enabled us to partially fund this. And it is a great way, to engage folks in the arts who might not otherwise, introduce them to artistic disciplines that they might not be involved in, and to create this sort of community-wide culture of health driven by the arts. And so right now, ArtsRx is also being made available to students at Rutgers Newark, to residents of the city of Newark, to folks who go to NJPAC, and to team members at Barnabas Health. So it is expanding, and frankly, the ramp up of it and the establishment of it was fairly straightforward. And what we've discovered around the country is that folks are really interested in this, and getting an ArtsRx program happening in your town is not as challenging as it might seem at first glance. So I encourage you to look into this, because what we're doing is we're creating a culture of health, and we're advancing cultural literacy. So it's sort of a win-win.
That's right. And John, you're right, this is a space that's growing rapidly, right? So arts prescribing is a part of a broader context of social prescribing, which is a global movement. Social prescribing is now in place in more than 40 countries in the world. In the UK, it's been national policy for over 15 years with major investment from the NHS. In the United States, what we're seeing in the social prescribing has been in the United States for a long time, but limited to social determinants of health and food, housing, transportation, basic needs. But now we're seeing an expansion in this global, what it means in the global context, which is about connecting people to community-based resources that are about social connection, right? We're living in a pandemic of loneliness, and we know the physical implications. Loneliness is as a cardiovascular risk greater than that of obesity or inactivity, and equal to smoking 15 cigarettes a day. It's a huge, huge risk. So social prescribing is about connecting people to those local resources for connection, and arts, culture, heritage, nature, volunteering are what are being referred or prescribed. We just did a set of 23 case studies, which you can find online. There's a toolkit for arts prescribing in the US. Programs are bubbling up all over the place because this idea is making sense to systems. Michellene, I wonder if you could talk to this audience about how they, as arts professionals, could approach a health system in their community with an idea like this.
I love the question, Jill. I really think that every single person in this audience has the chance to effectuate community change as a result of so doing. And I think that a great deal of it has to do with speaking their language, right? Hospitals are driven by things like, of course, their reimbursement, but also, so what impacts and affects that, right? Their Prescani scores, i.e. their patient experience scores, et cetera, and a variety of other quality measures are really things that they're going to sit up and pay attention when you begin to talk to. I really think this, to me, is such, it's not a debate, because I really see this as being so intricately interwoven, arts and medicine, that merely approaching your, if you have a nonprofit hospital in your region or a nonprofit healthcare system, every single nonprofit hospital has to do community benefit. There is something called a Schedule H in their 990 that literally indicates that they have to be able to evidence, really, so why should they be given their nonprofit status? So much of that is about what are they giving back to the community, right? In certain states, that's charity care, right? Accepting those who do not have insurance and taking care of them. But also, it has a great deal to do with your presence in the community in a variety of different ways. You heard John talk earlier about what I like to call the low-hanging fruit, right? The screenings that took place in the very beginning, before we began to scratch that surface and do a deeper dive into, but what does the community need? So there's always a community needs assessment. And these community needs assessments are available online. If you literally go online to your local hospital, if they're a nonprofit hospital, and take a look through their website, you will find it, I promise you. Or you can go on Candid and get their 990, but I didn't tell you. So as a result, right, you have an opportunity to take a look at a catalog of everything that they do within the community. Connect the dots for them and reach out to their external affairs department, their community affairs department, their community health workers, their population health department. Reach out to their government affairs department. I used to oversee government and policy development, as well as community health, employee health, et cetera. There are intrinsic lines that connect through all of this. And you, my friends, conduct that orchestra appropriately. So I do want to say this, Jill, if I may. And I said this to Lisa, your president, recently, and that is that in our current environment, as we all know, there are certain buzzwords, there are certain things that we are no longer supposed to be able to talk about. The issue with that is that if we stop doing the work that those things, those topics, those words described, people will die. Folks don't want to talk about things like health equity anymore. But Black maternal mortality in the city of New York is still 12 times that of the national average. 12 times. Across the river in New Jersey, it's 7. Right? Nationwide, we like to say it's between 3 to 5%. If we stop doing those things that were described by words like addressing healthcare disparities that now we're not supposed to say inside of these heavily regulated institutions, people will die, families will wither, dreams will be cut short. And to me, firmly as I am sitting here before you, I truly believe that the arts are not just one of the ways in which we can combat this. It is the only way that we can combat this. What I cannot talk about, you have the incredible ability to have me see. What I cannot say, I can still feel. And art to me conveys this in palpable, emotive ways that evokes change within a person. You cause the evolution of a human being, of thought, of process, of medical protocol. That is the power that you hold in your hands, and then let us talk about it as it relates to you and your well-being. The impact that it has for you to know, quite frankly, as an artist, that I am the rising and the setting of the sun. But that by shoring up this institution in my local environment, I am bettering their care of me too, right? I have to call this one particular play out. It is a one-man act by David Proctor. It is called Throwing the Hammerling. This is by a classically trained artist who wound up, because of mental health challenges, becoming a trucker. As I am talking to you about it right now, I can feel it in my belly, my heart is beating faster, and I am near tears just because I remember the performance from 2 years ago. What this individual was able to do within 90 minutes on stage, oh y'all, I'm so sorry.
We got you.
Was to change the trajectory of the world for me and my organization. Because it is when I left that performance that said, unequivocally, any and everything we do with medical students from here on out must contain an aspect of the arts. Because it is only through the arts will we actually evoke the ability to heal in a real and substantial way. The tears you see are actually gratitude. Thank you for what you do.
Thank you, Michellene.
No, you're good.
Thank you, Michellene. And to your point about health equity, right? We know that these disparities in who has access to the arts persist in our institutions, in our country. And when we know that people who have access to the arts have more opportunities for better health, when we don't address these persistent disparities, we are doing harm. Right? So this is a really urgent issue in the arts and in healthcare. John, you had a comment. You wanted to follow up?
I'm not sure it's specific to what you said, but we're working now on a documentary based on a book called The Good Life. And The Good Life is the results of the Harvard Happiness Study, which was founded in 1938. It was a cohort at that time of about 750 men. And the original, over the course of decades, the cohorts included everyone from John F. Kennedy to the Boston Strangler. So it's a pretty broad cross-section. But what's been discovered over the course of that study, and this is the basis of the film, is that relationships, a sense of usefulness, and engagement in activities that bring one joy are the keys to a long and happy life. And right now, we're in the middle of building a 60,000 square foot education and community center on our campus. It'll have 12 smart classrooms. It'll have a children's art reading room for the youngest readers. It'll have professional grade rehearsal studios where we'll give space grants to our Newark artists. We'll have a black box theater where community will come in and be able to produce and present programs for free for each other. This kind of ecosystem, intentional ecosystem of the arts is a thing that brings community to life, brings community joy, and again, is a road to improve community health. That was what I wanted to say.
Thank you, John. And Nataki, you have something?
Yeah, I did. I'm so moved by you being moved, because it's a good reminder that that's what it's all for, right, is to remind us to sort of reconnect. I just want to invite every arts leader in this room to take a deep breath, because what has been offered here is yet another thing to put on your plate. And it's important that we call that, and as we see it, that part of what happens in the artistic leadership space is there's a level of overwhelm. I remember saying plain-faced to a doctor after she asked me why I was so dehydrated that it was like famine-level dehydration when she checked my numbers. And I said to her plainly, well, I'm working 90-hour weeks, and so I don't really have time to go to the bathroom, so I don't hydrate. And she looked at me as if she was ready to send me upstairs to a certain floor for a mental evaluation. So one of the things I wanted to say is it's important and this is what I do as a leadership coach. In my work, we start with the leader and their well-being first. Because you can't actually center something for other people that you don't center for yourself. So if you're not drinking your water and, rolling around on the floor a little bit to do what might be your version of yoga on your yoga mat, and if you're not taking a walk, one of the things I lost during COVID was the ability to walk across campus. I can't tell you how much I lost. I can't tell you how much my body broke down. Right? So the physical well-being of the arts leader, who's almost always an artist, who became an administrator, is equally as important as the output of the work that they do. That the service actually has to center them, and then their staff, and then the artists that they serve. And so as you're thinking about, how am I going to go to my local hospital and get access to this resource, or go talk to my mayor about it, first ask yourself how you are centering that right now in your own personal well-being. Where are you embedding that practice? Because it's easier to access it if you know what it's doing. I remember having an emotional moment and thinking to myself, why am I crying? I do this all day at the office, because I make theater. And, a friend of mine was like, yeah, girl, you're human too, right? You actually have to engage like everybody else. You don't get to pay at the office. You actually have to do it too. And so while a lot of us benefit from engaging the work that we do, and we get the special benefit of sitting in rooms while people unpack ideas, and the artistic life and the expression of the artist is so deep and profound and moving, and being that is also deep and profound and moving. Coming back to yourself, making sure you invest in yourself is also deep and profound and moving, and exemplary of the work you're going to try now to convince your board that you need to be focused on.
Yeah, I would second that. I think that's such good advice. We, at our place, for example, we have yoga at least once a week, and we invite any team member to come to that yoga. And I encourage our people, and I say this at all staff meetings, take 20 minutes a day and meditate. Find that time in your day to do it. And I try to model that myself. For the leader to encourage a healthy environment for staff, it makes it okay. You give people permission to be healthy, and most folks try to take advantage of that. We also have a small business. We have 125 full-time people, but within our company, we have 7 different ERGs, employee resource groups, where the teams get together, whether it's LGBTQ+, whether it's wellness, whether it's caregivers, whether it's African American or Latino. These different ERGs work together, and they work collaboratively, to build a positive culture within the organization. To be able to make time for that makes everybody that much more productive. Yeah.
We got to practice what we preach,
Yeah,
right?
yeah.
There are things that as professionals we forget about what we know, and that's a huge issue. I'm also hearing in this dialogue a call for somehow all of us who are in the arts to be a part of a shift in which we as Americans, and I'm talking about America now, reclaim or drive a paradigm shift in which the arts are not elite, and they're not frosting, and they're not for people who can afford it, and they're not for people who live close, but that we all reclaim the understanding that, like exercise, like good nutrition, these other understandings we have, that being creative, engaging in the arts, whether it's a local festival, a church choir, setting our table beautifully, singing in the choir, taking up an instrument, whatever it is, that is our birthright for health, and it's an important tool that we have for health. So there's a societal leveling. We know from the research on arts and health that in other countries, in all ranges of development, where there is greater investment in the arts culturally, socially, and politically, people engage more, the arts are more a part of the fabric of life. And that's just not so in the United States. So I'm hearing that challenge to us all. How do we make money as businesses, right? And also ensure equal, equitable access to the arts in this country? Nataki.
And also in communities across the country, people are already doing this. You know, so you would be joining the work of people who are already engaged in this. And who may not have access to the sort of large pool of resources, but they create access for other people. And, you know, thinking about Miss Faye on the banks of the Mississippi, and she made this decision that she was going to do a gospel concert on the banks of the Mississippi in Arkansas. And I think what's profound about it is that it hadn't been done. People don't, you imagine that people that close to the Mississippi go, they don't. They don't access it. They don't go to the water. They don't claim the water as theirs. And so she did this gospel concert on the banks to remind people to come back to the space of restoration. And she was going to do that whether we said she should or not, because she understood the impact of that art on the health and the well-being of that community. It was necessary to open the gates again, to make sure that people knew that they could access this. And so just know that somewhere nearby you, somebody's already doing this, and maybe what your job is to make sure that they have access to greater resources to be able to continue to do it, or to do it in more profound ways.
That's right.
Jill, can we add to that the fact that even in answering the question that you asked me originally, right? So how can artists approach their hospitals or healthcare systems in order to do this? I love what Nataki just said. And so much of it also has to do with serving the community around you. Finding those who are already in this space, they are already serving, and perhaps partnering with them, right? Making certain that all that research I asked you to do by taking a look at the 990 or figuring out something else, they may very well already be in connection and in collaboration with that hospital. Go to them first. And one of the things that I think is really important is that element of trust, right? And the truth is that across the country, as a result of that history that now we can't mention as well, there is a lack of trust from most communities and the healthcare institutions. It's the institution itself. It is a well-earned amount of distrust, full disclosure, right? Forced experimentation, forced sterilization, you name it. And not long ago, right? But we all know that this was still going on in the 1970s, some in the 1980s. Think about Philadelphia. So I would encourage you to really get involved with those community groups. Offer your talent to them, offer a hand, but also do it, as I used to say to my fellow healthcare administrators, with an incredibly embodied sense of humility and understanding that although we may have MD or ESQ after our names, they have PhD in their own lived experience.
Here's a very simple, a really simple thing that anybody can do. We do it. Newark Beth Israel Hospital is our sort of anchor hospital in the city of Newark. We deliver teaching artists into what's the baby ward? What is that called? The pediatric ward, right? Yeah. Senior moment, folks. The pediatric ward, and these teaching artists go in. They work at the bedside with the patients, right? And we're now in the gerontological ward as well, working with the older patients. We also do music in the lobby. This is not brain surgery, but it is so meaningful. And over the past couple of years, we've reached almost 25,000 people, either through these free music and dance events in the lobbies or bedside. This is not hard for us.
And
it's so
the
meaningful.
CEO of that hospital is now on my board. Yeah.
Awesome. And he's on my board too, yeah. Right? But what's really interesting about this to me is that the hospital workers, the healthcare workers in the hospital, they are remarkably stressed, as we've said. So being able to deliver performances for them as well, we're also going to now be introducing comedy into this mix. Give folks an opportunity who are working in this remarkably stressful environment a chance to laugh a little for 15 minutes over the course of a day. Any of us can do this.
Well, there are so many win-wins in this situation, and so many opportunities. We're all like vibrating with the resonance of this conversation, and I'm kind of guessing that some of you may be as well, and I want to give you an opportunity to bring questions. We've got someone at the microphone already, I think. Yes.
Got a spotlight.
Thank you. Dr. Sonke, it's good to see you. It's Liav Sofer from Urban Voices Project. For the panel, I just want to say first, before anything else, that I'd like to kidnap all 5 of you, please. Either to come and fly you to LA to talk to my people and the world around me to convince them of these things, or 2, if you all want a seat on my board, like, let me know what's up, let's go. My name is Liav Sofer.
What is your organization?
My name is Liav Sofer, and I'm the founder and executive director of the Urban Voices Project. We were founded 12 years ago as a community choir in Skid Row, Los Angeles. And the focus was the intersection of arts and homelessness, but we quickly learned that, as we know, we all wish homelessness is not an industry anymore, of which that's not the case, but we dream for that the vision of where homelessness disappears just into public health. That would be the dream that we had. And we were steering the ship for so long towards that dream. In fact, we were born through a co-location experiment at the John Wesley Health Center in the heart of Skid Row, which for those that don't know Skid Row, it's the epicenter of homelessness in LA, but it's also the epicenter of homelessness in the nation, with a 1 square mile of over 9,000 people experiencing homelessness or insecure housing of sorts. So we started at the Core Community Clinic, the nonprofit hospital that was serving the community, because they had an interesting conundrum where they would have appointments made all day long by some of their clients, of which, such being a transitional community, were not making it to their appointments. Meanwhile, they had a line out the door waiting to get in, and nothing was happening. And doctors had to sit and wait as appointments that were empty went and left, came and went. And there's people trying to get out. So a co-location idea of let's have a community singing workshop in the clinic might allow people, just as you heard the example, to actually be reached by their doctors, being pulled out of the singing workshop, seen by the doctor, put back in. And then as we worked on that experiment, we also found that guess who else was singing? The nurses and the doctors. And not only that, but the power dynamic of the person that gives service versus the person that receives service. In the work of service, sorry I'm ranting and teaching a little bit, but I do have a question, I promise. In the work of service, there's an inherent power dynamic of you're broken, you don't have your health together, you don't have your housing, and I have a charity, I can give you something. It just perpetuates the lack of dignity and integrity in an individual. So when you can have them sing side by side, using art as this universal equalizer of both the receiver and the giver of service, it was phenomenal to watch how the trust was starting to be built back, Michellene, right? So this was phenomenal work, and we've been doing it for 12 years. Beyond just the choir, we now have workshops and community clinics, as well as a big partner that was a surprise to us was libraries, who had mental health arts funding, or mental health funding that we channeled it to the arts. And libraries are a sanctuary for people experiencing homelessness. That's one reason why I wish I could take all 5 of you into a room and really have a deep, deep talk with everybody. And I have had a great talk with Dr. Sonke before. But here's my conundrum, is that we've been steering our ship in the direction of arts and health as the long-term investment for many, many years. And to hear everything that you guys have accomplished is so exciting. Meanwhile, we're not that large. We're only a $600,000 operating budget a year nonprofit. We're mid to small size. We've been chugging along as best as we can, and $240,000 was rescinded and cut this last year due to the big, beautiful bill, of which trickled down to Blue Shield in LA, Kaiser, Molina, and LA Care, our biggest healthcare plans, who used to corporate sponsor or grant to us up to $240,000 a year, a large portion of our budget. It disappeared in 4 weeks. Completely. I got my usual $75,000 check from LA Care came in, which they granted, and I have an email from, and it showed $2,500. And I said, you're missing a 0 and a little extra tail on the 7? And they said, sorry. So I'm here, maybe I'm having a conversation that's a little bit deeper than what we're doing today. It sounds like today is like advocacy to try something new for people that haven't tried it. I know I'm talking to you as a colleague who's been doing this, and I get that this question may be more complex, but could you also just speak more? Michellene, you were hinting on this, that arts can combat this current administration's attack on healthcare, but I do want to just say, I've heard success stories of $4.5 million endowment. Like, John, you and I need you. Please come to have coffee with me. But how do we navigate the fact that a lot of this avenue that was so exciting, and as you're saying, small people like me and my organization and Skid Row got fucked real hard this year. And we are now literally saying we have to diversify away from arts and health for this next 3 years. Can you respond to what you think? Is it just wait it out until the next administration? Is it, where do we go? And I'm not a large organization, so we don't have the same resources as perhaps a legacy institution and a performing arts center. So if you can speak to that in any future-proofing concepts, that'd be great.
You go for it.
I just want to say, because I hear you, right? I don't know how to say this without sounding so strange. It sounds so right in my head. But the money is out there. It's really diversifying access. You know, that's our money that went into the big, beautiful bill, just to remind us all. That's our money, right? And the people who don't actually pay taxes are still interested in funding projects. And that kind of research takes a lot. It takes a lot of energy and time, and it doesn't sound like you have all of that, right? But it's going to take some creative thinking to get access to the money, because the money's there. It's finding the people who will provide that kind of access. There's still somebody out there. You know, I thought for 15 minutes, before he decided he wanted to become governor, that somebody like Tom Steyer, right, who created banks and all these points of access in the state of California would be somebody to go to. But he's got a friend who's got money, who's interested in putting their money towards something like your project. And perhaps it is about thinking about diversification of access to resource, as opposed to just going through the hospitals. Because those are corporations, and they're going to go the way the money goes, as well as wealthy individuals. They're going to go the way the money goes. But I feel that pain. Yeah.
There's a funder in LA, and you may know them. It's the Music Man Foundation. Are they a funder of yours?
They're national, and they have a base in Florida as well as LA. They actually decide to fund one year and then the other region the next year. And we've tried to apply many times, but we're so niche, they haven't really understood the work, because it's not just health and arts, it's homelessness and health and arts, which is confusing for them.
So, you know, we define ourselves at NJPAC as an anchor cultural institution. That is, we're here, we'll be here, we're in service to community in ways we know and ways that we don't know, right? So is the LA Music Center, Skid Row, as I remember, is pretty adjacent to the LA Music Center, right?
6 blocks away.
Exactly. So one would think there's a conversation to be had with those guys. Are they interested in that conversation?
Music Center's been a great partner, but in the arts economy as it is, they're offering us space, and that's it. Like things like that, you know.
Right.
Which I don't want to act ungrateful, of course.
Yeah. Anyway, I'd be happy to chat with you about our funders, because the funders are individuals, they're foundations, and they're corporations. It's sort of, you know, there are a variety of ways in with this work, because the ROI in this work is real. You know, and what funders are interested in, you know, we're in the arts, you know. We often can't prove the ROI on the work that we do, but this is a field where you can prove it. And so I'd be happy to chat with you about that. Yeah.
Thank you, Leah, for bringing all of that. It's really good to see you. And I want to acknowledge the hardship and the labor that diversifying means to a small organization. And also note that there are some efforts, philanthropies are talking collectively about how to help in this moment. The Federal Reserve Bank is doing work around things like community bonds and economic modeling. So there is their brain trusts thinking. So good to see you. Next question, comment. Thank you.
Yes. So to clarify what you were saying, John, you said that most of your funding went away from NEA, right? Most of the funding went away from NEA.
We get no federal money at this point.
Correct. I'm saying like that was a majority of your funding and it's gone.
No. It was not the majority of our funding. It was a de minimis part of our funding.
Okay.
We were delighted when we got it. We were surprised, in fact, when we got it. And when it went away, we weren't surprised, given the horrible man in orange.
Sure. The rest of it was through the funding partners that you mentioned, or was it through the hospitals? It had to do, the fundamental funding had to do with the work that we did over a period of years, imagining what these programs might consist of with Horizon Blue Cross Blue Shield, the healthcare provider, and with RWJ Barnabas Health. Okay.
So after a couple of years of lots of due diligence, lots of community outreach, lots of community conversations, we were able to put a plan together where we went for 7 figures from folks as an endowment to secure the start and the future of the work, right?
Yes.
I'm not sure how that money will advance going forward, but the fact that we were able to start the work and prove the value of the work enabled us to go to other funders and say, look, come on, join us in this.
Sure.
Yeah.
So my actual question is, from the nuts and bolts perspective, did you bring to the table, here's something we can do, here's something we can do, or did you start the conversation and let the medical practitioners
we created the initiatives collaboratively with the funders who saw the value of it for their own clients, for their own participants, right? If we can if by virtue of this work, 3% less people go to the emergency room at Newark Beth, here's to us, you see? If we can improve the environment at the hospital for patients, for visitors of patients, and for healthcare workers, here's to us. If we prove the value on a daily basis, it's easier to ask for money.
Excellent.
Does that make sense?
So I want to note that we have 3 minutes remaining, so we can probably take one more quick question, and we probably are willing collectively to linger a little bit for other questions off stage. Yes.
Hello, everyone. My name is Bertrand Evans Taylor. I am the Director of Government Affairs at Dance USA, and I'm also a social work student. And so excited to be here. And one thing that I've been thinking a lot about this weekend is research. I found a systematic review of exercise treatments for major depression, and they said that one of the best exercises for depression is dance, maybe. But there's not enough high-quality research with robust methodologies for them to be certain of that. How do we advocate for that type of evidence base to support what we already can feel to be true?
So this space is changing quite a bit. A couple of places to look to: the Jameel Arts and Health Lab, which is a WHO, NYU, and Culture Runners collaboration, is really advancing the evidence base. There's more and more evidence synthesis right now. Nature Medicine just published its first 2 papers on the arts. One is on how the arts can help with prevention of NCDs, non-communicable diseases, which are responsible for 74% of deaths globally and are preventable. The other is a study that suggests that arts participation can influence biological aging and epigenetic clocks, so slow the aging process. So Nature Medicine, these big journals are coming into this space. The NEA, in its current state, has preserved its research funds to date, and 17 of its research labs have focus on arts and health. So we can still look to the NEA for resources for research for arts and health. And talk to me offline if you like. I can talk with you more about the evidence base, but it is growing. And one note, just a teaser, this year we're going to see publication of more biological studies, where now we in EpiArts and in other labs now have biomarkers, and we're able to analyze the effect of arts participation on proteins in the body that affect things like diabetes, cardiovascular disease, depression, those sorts of things. So those studies will be coming out this year. That was the game changer for exercise in the 1980s, being embraced by healthcare as a health resource. So we're anticipating an interesting year in this space around research.
Wow, thank you so much.
So we just hit 0. If we could, do you mind?
I have a gift. I have really a gift for everybody.
Oh my goodness, please.
I went on AI.
To the mic.
To the
mic. Oh, I'm sorry.
Yep.
Danae Bar, Columbia, Maryland, in the Washington, D.C. area. I actually went on AI, and I put in, let me just tell you, it really revolves around the value of having an arts and healthy communities summit or experience. Okay, a good title for a summit on a cross-sector, multidisciplinary, interdisciplinary art engagement as a catalyst for joy and healthy communities should be engaging, descriptive, and memorable. Here are some strong titles here. Arts as catalyst, sparking joy and building healthy communities. The joy factor, catalyzing community health through cross-sector arts. Creative communities, interdisciplinary arts as a path to health and joy. Converging for connection, cross-sector arts engagement for community vitality. The intersection of creativity and care, a summit on arts and health and community joy. Bringing sectors, cultivating joy and health through collaborative arts. Ecosystem of joy, cross-sector arts engagement for healthier tomorrows. And let me tell you what need to be done is in this summit, you would approach, say, a health foundation, because any health foundation will listen. If a group of just 10 artists come to this, say, we just want to have a conversation. We'd like to have a summit that revolves around art and healthy communities. But also within that summit, what you need to do is have a clever space, like you say, to host that summit. It might be an outdoor park area. You will have lectures, things like that. But then in the breakout sessions, if you will actually have interactive art engagement things going on, a skit, a play, something like that. But they're only 5 or 10 minutes, amplifying whatever you are going to be talking about in the different engagements.
Beautiful. Let's have a summit. Thank you.
I had to get strategies. Come on. Let's go.
Yes, beautiful ideas. Beautiful, beautiful. Thank you, everyone, so much for bringing energy and life to this conversation. Thank you to these amazing leaders and panelists. It's been such a pleasure to be in conversation with you all. Thank you.